Today I'm going to show you double outlet right ventricle. This is four chamber view, apical four chamber view. This is left atrium, this is left ventricle, this is right atrium, this is right ventricle. So apical four chamber view, quite easy to understand. In this case, what you see, you can see here the ventricular septal defect. So this is left atrium, left ventricle. This is ventricular septal defect. This structure is also pattern foramen oval or very small postum secondum ASD. You can guess here. Now the next image. This is color flow of same apical four chamber view. This is left atrium, this is left ventricle, this is right atrium, this is right ventricle. This is the flow from pulmonary vein into left atrium. This is flow either PF or very small ostem second MSD from left atrium to right atrium. This is apical four chamber view. Now the next, again the same thing, same view. This is the view. Now you can see very, this is the turbulent flow is in the pulmonary artery and non-turbulent uniform color flow is in the aorta. This is aorta flow. This is pulmonary artery flow. Obstruction is at the level of valve. You can see where the obstruction is mostly at the level of the valve. Next image. In this image, what you see, this is parasternal long axis view. And what you see, the most important thing, this is pulmonary artery and this is aorta. So this is left atrium, left ventricle, and this is pulmonary artery. Pulmonary artery is getting mainly from right ventricle and less from left ventricle. That is why we are calling it double outlet right ventricle. Pulmonary artery is getting blood from both ventricle, but mainly from right ventricle. So most part of the pulmonary artery is dedicated to right ventricle. You can see the overriding of aorta, but its overriding is such. So sorry, overriding not aorta, overriding of pulmonary artery, but overall what you see, the most portion of pulmonary artery is coming from right ventricle. It means more than 50% of pulmonary artery is from right ventricle, and less than 50% is from left ventricle. This is this nomenclature. This is left atrium. This is left atrium. Left atrium. This is left atrium. This is left ventricle. This is right ventricle. And this is pulmonary artery. As you see, the pulmonary artery as is come from left ventricle is going posteriorly. So if it is coming more from left ventricle, then it would be detransposition gate arteries. But as in this case, it is coming more than 50% from right ventricle. That is why we call it double outlet right ventricle, because more than 50% of pulmonary artery is coming from right ventricle, and less than 50% is coming from left ventricle. If the scenario gets reversed, more than 50% from left ventricle, less than 50% from right ventricle, in that case, it would be detransposition of gate arteries. So in this case, as the pulmonary arteries more than 50% coming from right ventricle, and the aorta is almost coming from right ventricle, exclusively coming from right ventricle. That is why we call it double outlet right ventricle. You see, this is pulmonary flow. This is aortic flow. This is aortic flow. You see, this is aortic. Aorta is anterior to pulmonary artery. pulmonary artery, then aorta. This is aorta. Aorta is almost coming from right, exclusively coming from right ventricle. This is aorta. So now for nomenclature purpose, this is aorta, and this is right ventricle. So aorta is coming 100% from right ventricle and pulmonary artery more than 50% from right ventricle. That is why we call it double outlet right ventricle. Moving image. Aorta. Clearly see what is the finding in this case. Parasternal long axis is only view that will tell you exactly whether it should be double outlet right ventricle or detransposition. That is, this is the view that will tell you exactly about this finding. Because this in this view we are getting image is very probe is very close to aorta and pulmonary artery. So this view is taken as a standard. If same thing, if you are getting from subcostal view, you may be correct or may not be correct. But if you are getting this thing from parasternal long axis view, that will be the most accurate. So finding is most accurate double outlet ventricle because we can easily see here the flow from left right ventricle is coming into pulmonary artery and flow from right ventricle is going into aorta. So ultimately, this is our right ventricle. So this is the best view because in this view we are very close to the structure of interest. That is how a great artery is coming from ventricle. Again, the same thing, same structure. This is aorta, this is pulmonary artery. So aorta is anterior to pulmonary artery, and this aorta is anterior pulmonary artery. This is subcostal view. This is aorta, this is inferior vena cava, and inferior vena cava is right side, aorta in the left side, inferior vena cava is anterior. This is the most anterior portion, this is the most posterior portion. So IVC is anterior and right, so normally related. So situs, serratus, and levocardia. That is the position in this case. This is left atrium, this is left ventricle, this is right atrium, right ventricle. This is left atrium, and this is very small ostium secundum ASD, and here this is inlet VSD that is extending into outlet region. So large inlet VSD extending into outlet region. This is again the parasternal long axis view. You can see the VSD flow of VSD is from left ventricle into right ventricle. Why? Because ultimately right ventricle is giving flow supply to the both great arteries. So right ventricle has to get blood from left ventricle. So in this VSD, what you are getting flow from left ventricle into right ventricle. Color wise, it is mainly red in color. You see, the red color means flow is going upwards, so flowing going from left ventricle into right ventricle. That is expected color. It should be from left ventricle to right ventricle and right ventricle to both the carries. So this is subcostal view. See here, all the color. This is aorta coming from right ventricle, and pulmonary artery is also mainly coming from right ventricle. In this image, you see this is left ventricle, this is right ventricle, and this is aorta, and this is pulmonary artery. However, for final confirmation, always you have to see parasternal long axis. Why? Because in parasternal long axis, our probe is going closest to the structure interested. So whatever the interested structure of interest, that comes very close to probe in parasternal view. So for confirmation, always we have to take parasternal long axis view or short axis view, whatever is possible. But this is subcostal view, you can easily find out right ventricle, aorta exclusively coming from right ventricle and pulmonary artery coming from right ventricle mainly. So ultimately, this is double outlet right ventricle. This is subcostal view. This is left ventricle. This is your pulmonary artery. This is aorta. Aorta is coming. And the initial part, you see the both in the initial part, both are parallel. So this is if in this scenario, in a similar scenario, if the pulmonary artery comes more from right ventricle, left ventricle, then that would be D-transfusional gate artery. Simply as this structure, it goes just shift towards left ventricle, then what would happen? It will become D-transfusional gate arteries because the structure is parallel. Atrioventricular concordance and ventricular artery discordance, that is called D-transfusion. But in this case, what has happened? Pulmonary and aorta is more, both are shifted towards right ventricle. Ultimately, both are shifted towards anteriorly. Ultimately, more portion of pulmonary artery is coming from right ventricle and it's dedicated to right ventricle. So this is double outlet right ventricle. Thank you.